So today we've got a special treat. Derek, Harley, and I were talking at the summit in August, and those of you that were there, we're glad that you came and thank you for attending our annual summit. We were talking about some of the innovations and changes that are coming within our learning and development groups, and he had some great ideas that he's been implementing at M Health Fairview. And so I said, why don't you come and share this with our healthcare learning leaders? So today we are fortunate to have Derek. Now, Derek is part of our community and he has been active in the L&D community for over 20 years. And so he's got dedicated experience in L&D for healthcare. And at M Health Fairview, Derek demonstrates an unwavering commitment to enhancing the technology education and support by providing that we provide to the frontline workers. So he's dedicated to that. And through his career, he's navigated through various challenges in the healthcare industry. We've had many, especially with COVID-19, including overseeing 5 electronic health record EHR implementations, which are big with Epic and such. So 2 mergers, numerous upgrades, and a plethora of other projects arising from the ever-changing healthcare landscape. So we are very fortunate to have someone on the inside to share with us today best practices on engagement. So welcome, Derek. We're glad to have you here.
Thank you very much, Michael. I'm going to take just a moment to get my screen set up and shared over quickly.
And just as a quick reminder, while Derek is presenting today, you are free to drop your questions in the chat or at times when we take a quick pause, Derek will pause and you can unmute yourself with questions as well. So feel free to do either or both. Thank you.
Excellent. Thanks so much, Michael. Well, at the most recent Frederickson Learning Leaders Summit, I was chatting away with members at my table, and one of Frederickson's lovely staff came over and said, Derek, Robin Lucas has asked me to join you, have you join her briefly. She wanted to introduce me to Michael and chat a little bit about Healthcare Learning Leaders Forum. And as she made the introduction, one line stuck out to me. She said, and you're willing to share and post about what you're doing. Which brings me to my time with all of you today. One of the things that I think sets healthcare apart is that we're willing to share and learn with each other in a way that sometimes folks in a more corporate setting see as protecting proprietary information. And in healthcare, we have no choice but to learn from one another and see what others are doing, because sometimes we're doing the best we can with all that we have. Good afternoon, everyone. I guess it's good morning in my part of the world, but I am Derek Harley, he, him, his. I have the privilege to lead the EHR, HIT Learning Development and Delivery teams at M Health Fairview. Michael did touch on my storied history with education and e-learning, EHR education. I actually got my passion for training through Caribou Coffee. I was a trusted legacy trainer telling the Caribou story in late 1999 and early 2001, while I was also pursuing radio broadcasting. So storytelling and learning development and education just all kind of go hand in hand. And today I'm here to share a little bit of our journey and our story with you. But I don't have it all figured out. I surround myself with people who are smarter than me. They're willing to do bold things, and they're committed to our caregivers. And often that's what's important, is taking care of our caregivers. And that's a line you'll hear me repeat throughout, is that we care for our caregivers. Because if we're not caring for our caregivers, they're going to burn out and not have the energy and the passion to care for their patients. So this is our journey. And throughout today's presentation, I'm going to ask to hear from you. I hope you ask questions and share experiences. You open the conversation and learn from one another. I'm one part of the journey. Like I said, I don't have it all figured out, and I really do hope to learn from all of you as we move through today. Little bit of what today is going to look like, kind of looking back at where we started, our strategy of learning in the flow of work, a little bit of our change agent network, where we engage in social learning and engaging our epic influencers, my value that I place on data, and then a little look into M Health Fairview's future of learning and where we're going in that innovation. What you don't see specifically called out on the agenda is AI, and part of that is because you're going to see that sprinkled throughout the presentation this afternoon. So it all started because we wanted to make learning easier. Caregivers are burned out, and they have been for some time, even pre-pandemic. And so we wanted to make that learning easier and get it into the hands of our caregivers. And I think you need to understand a little bit about our learning solar system. I pick on the Epic cliches a little bit here. Epic being very space-based. They name their client hyperspace and hyperdrive, and they do a lot of space puns. So I leaned into a little bit of that. But our learning solar system serves a number of employment homes, both Fairview, University of Minnesota physicians, faculty members from the University of Minnesota, independent providers, affiliate providers that we have contracts with. And so we have this ecosystem where people were accessing learning in a number of ways. LMSs through various employment homes, SharePoint, in some cases, downloaded tip sheets that got emailed out. And in other cases, some of our affiliates just never even got the receiving end of a communication around upgrade training or changes that were coming to the system. We're a very matrixed organization, and because of that matrix, we have a matrix of systems contributing to that. Everything was decentralized. None of those systems talked to each other. We were all out there in that galaxy spinning around one another, but not talking to each other. And at that time, we had in-person training. So people were traveling to us 3 and 4, 5 hours away. We serve Minnesota and Western Wisconsin, including the Iron Range. And so we had people traveling in from quite far away. So our first way towards the easy button, and I will say there is not a such thing as one easy button, but there are ways to make it easier. The first step towards our easy button was to align those stars, and we aligned around a central distribution system so that we could reduce the burden of accessing learning content. So we chose a vendor that allowed us to centralize our learning distribution of our content. That vendor is also integrated with our EHR. These integration points are really important to us, and you'll see that as we go on today, because it allowed us to offer personalized learning for everyone. It recognizes who they are in our EHR, what their role is, and whether they're logged into an ambulatory clinic setting or a hospital setting. And that personalization is really important. We want to present the information they need when they need it at the moment they need it. And part of that is that we don't want to be presenting clinical help information if you're rounding in the hospital. And if you're in the clinic, we don't want to be presenting you that hospital information. But also, there was a big sticking point. And for us, that was an integration with the EHR so that there was seamless login to that content distribution system. Prior to having this, we used SharePoint a lot. And the second you started to send a link out to something that was located on SharePoint, it would present a login screen. And for many of our caregivers, once they hit that login screen, they're done. They check out. They don't know which login it is. Is it their Entira Family Clinics login? Is it their University of Minnesota Physicians login? Is it their Epic login? And they don't have the time to spend figuring out which login it is. And so this system allows that seamless integration. It recognizes them in Epic, passes them through to the content distribution system, and launches the material. But also, those integrations gave us an opportunity to embed learning in the flow of work. And so now we're putting access to learning materials where people need it, when people need it. Really great example of this is around our e-consent. So we launched some new processes, and instead of making people go find or search for the learning since it was so new, we put that right in their workflow. And that was all because we were able to find a system that was integrated with our EHR. So here's an example of learning in the flow of work. We centralized our upgrade materials and we started pushing notifications to one space for our caregivers. Prior to having the singular space for our caregivers, they might learn about an upgrade to our EHR through email, through the grapevine, through a staff meeting, but there wasn't necessarily one space for them to learn about it. We aligned that around what we call our Learning Connections dashboard so that they press F1 in Epic, that dashboard launches, and they're seeing material that is impactful to them. The messages are personal. They're embedded in that single dashboard. And this is the first start of our easy button, that press F1. So pressing F1 gets them material that's assigned to them. They can also click out to other places. One of the things that's in that screenshot is a link to an EHR HIT support chat. So we've also taken and stood up an ongoing Teams meeting, and they access that team meeting from this dashboard. And people can come in and chat questions live, real time with EHR experts so that they can get support in real time. One of the things that wasn't great about this is it required training our end users to understand how to use that personal notification. So in this case, they had to click the banner of that notification section, and all they see in that notification is that little bit of a preview sentence to it. And then they clicked that banner and it launched the full centralized distribution system, and they had to then search for the notification. So it was one step forward. It was a little bit better than what we had before. We've since stopped to make that easier. Those notifications have become interactive. So right within that dashboard, the notifications, they can click on the notification, they click in that space, the notification opens, they can read the notification, acknowledge the notification, and even launch the learning material from that notification. And it all stays within our EHR. So again, I'm in the EHR working through that material, and I can see it. I know it's mine. I know it's been assigned to me. So we've seen a pretty good increase in our upgrade engagement. Now, don't laugh too hard, but our upgrade engagement is about 10% participation. It's not required. It's not mandatory. We're in a staffing shortage kind of situation. Often we're over capacity in our hospitals. And so we're not going to require that a nurse comes off the floor because they haven't read about the changes that are coming with the upgrade. So we don't require it. 10% for us is 3,000 to 5,000 people, depending on the audiences. And so it's a pretty big deal. I was just at another conference last week, and I was talking to another organization, and they were celebrating their most read Epic upgrades ever, and it was 65. So they had 65 engagements in an organization of 1,200 people. So 5%, which is about where we start. 5% is usually what happens in our first launch, our first week of launching our materials. My 5% looks like 500 people, and their 5% looks like 65 people, and they were very excited about that. So I'm happy that we've gone from a 2 to 3% engagement rate to a 10% engagement rate by putting some of these things into that flow of work. And here's another example of an integration point. So that was all related to our upgrade materials. But here is an actual integration point, and I apologize, I have to blur out all the screenshots. Can't make it look like you know which EHR it actually is. But in this, we have embedded learning material right within navigators and right within workflows. So this is one of those examples of giving them that information when and where they need it. This is an example of our emergency department navigator, and they launched some new tools. And as a part of that new tools, we embedded some tips and tricks for them right there. That actually opens a second window within Epic where people are able to participate. They can either read a tip sheet and it's labeled, hey, this is a tip sheet. They can watch a quick overview video, or they can participate in some of the simulations. And in some cases, they could do all three. They can launch a little lesson that lets them choose their own adventure, and it's got a tip sheet, a simulation, and a video in it. So we put that choice in the hands of our learners around which particular method they like to learn from. I jokingly say that I'm the IKEA guy that breaks open the furniture and starts building it. And then I go to YouTube when I get frustrated. And then my last resort is to actually pull out their animated little guide. It's my last resort. And there are many, many people who don't want to read that tip sheet first. They want to watch that video in order to get the support. So I've been focused really heavily on embedding in the flow of work. What is a challenge of embedding in the flow of work? And I have one, and it's based on an assumption that I was making. I'm not going to tell you quite what that assumption is yet. Let's see what you come up with. Either drop in chat what you think a challenge of embedded learning is, or learning in the flow of work, or please feel free to come off mute and share with us. And we will have a very fast 90 minutes if we don't get responses. Doesn't always answer the question. Good. Yeah. Are you getting to the question? People don't feel like they have time to look at it when they try to do something. Yep, absolutely. Pop-up fatigue, incorrect guidance from the pop-up. Absolutely. Now things are moving. In other EHRs or even on paper, we may not have an easy way to truly embed. Yep. Differing roles and responsibilities. Yeah. Having enough time to complete the course. Good. Also, two other things. If I'm a provider in front of my patient and I don't know how to do something, do I really want to start reading through that learning or that tip sheet or watching that video in front of my patient and maybe impact the trust they have in me as a provider? Well, if he doesn't know how to document, or if he doesn't know how to do this, how trusting am I going to be or of them if in my care? And here's the big assumption. I assumed that in the flow of work meant in the EHR. And then I went out to the hospitals and witnessed inpatient nurses spending barely any time in the EHR. They would go into a patient's room, scan their bracelet, give their meds, document that they gave their meds, sign out of the EHR, and walk out of the patient's room. That's not a place to engage in learning. And then when they were out on the floors, they weren't on their computers. They were pulling meds for their next patient from their pharmacy machines. They were prepping meals. They were doing a lot of other work that wasn't actually in the EHR. So I'm not meeting them where they're at. We have some ideas around how we can potentially meet them where they're at. But then we run into some of the technology issues. So one of the cool things that we could do is put QR codes in some of the spaces where they might have a new workflow, especially around some of the pumps and the pharmacy devices, or even at their Epic workstations so that they could just launch their learning materials on their mobile devices. And then our organization became the challenge because they have shut off access to the cameras on our managed devices. So we're working through some of the protocols and security policies that we've put in place in order to get access to some of that learning material. Robin, I like in your experience when your doc does that, I appreciate it. I absolutely love when a doctor asks me for help at my appointment, but we're the special kids that love learning and love making that engagement for everyone, right? Others, it's an interesting perception of trust. So, but I'm absolutely, I love being able to say, hey. But what does the data show? So here's the other moment. We are a data-driven organization. And so here's what our data shows. In two different case studies within our organization, We launched a new workflow around e-consent adoption. And in that e-consent adoption, we initially had 8% adoption. Once we embedded the help in the flow of work for that, it went up to 87%. And then in our CPM, our clinical practice model education, that had a 10% engagement rate through the LMS. Once we embedded that education in the flow of work, that engagement rate went up to 80%. So one of those numbers is adoption, one of those numbers is engagement. In both cases, embedding the learning in the flow of work increased that engagement, leaps and bounds. And so then now at this point, we need to learn from that. And I think a couple of folks in chat touched on it. Is it the right thing? Is it updated? Is it correct for this process? So we're trying to get better at understanding, are people finding what they're looking for, and was it helpful? Did they abandon their open or their search, or did they open the document? So we're working through all kinds of data around that. And then we started engaging our Epic influencers. So we had this new centralized distribution system, and we still had our email communications going out, and our email communications go out via Salesforce. So we know from the centralized distribution system who is participating in our learning, and we know who's reading our emails. Can we identify the people that are doing both and invite them in to our Epic Influencer Network? So somewhere in 2001, I think, I couldn't quite remember if it was 2021, maybe early 2022. I'd watched this documentary about how social media was mining data and potentially controlling the way people think about various topics within our psyche and our national conversations. And that got me thinking about all the data we had within our organization and how we could utilize that to help people understand that there are resources there for them. So prior to this, our change agent network was made up of leaders to cascade messaging. A lot of that is because of OCM. So org change management says the person that people want to hear change from is their direct leader. So we invited the direct leaders into an Epic change agent network and asked them to cascade information. But we added in about 155 new influencers to our network by identifying the people that were also reading the 90-second news email and engaging in the learning, and then ask them to go out and influence their peers. And that's when we started to see our uptick from 3 to 5% upgrade engagement to 7, 8, 9, 10%. So it's coming along. It's making strides. Part of what we did there too is we offered them kind of exclusive content. We started a What's New webinar so that they could ask questions to instructional designers instead of just read the material and then go figure it out in the EHR. They can now ask questions directly to instructional designers about how changes might impact them differently. This is the question I asked. Can we create viral learning moments? Now, I can't say that we've actually created a viral learning moment yet, but we do continue to focus on meeting our end users where they are and giving them the help that they need. Again, the same conference that I attended last week, another manager came up to me and said, I was inspired by your question. Can we create viral learning moments? And here's how I've applied that. I've started writing clickbait type titles. 10 things you don't know about the EHR, but you should. 5 things your colleagues are doing better than you, to get that idea of getting someone to click into an article and read it. I haven't gone that far, but I am very intrigued by what she's thinking about there. And then ultimately taking that cue from marketing and the final image here And unfortunately, it's kind of small, but it's getting to that point of if we can understand who our users are, what they're searching for, what they need, what our gaps in our offering is, can we get to a more personalized experience? Can we get to a Netflix or an Amazon-like experience that says, other people are checking this out, or based on your past searches and history, you might be interested in blank, and give them some of those suggestions. We also have access to some data from, so our EHR is Epic, but from Epic themselves that shows how people are performing within the system. Are they spending more time outside of clinic doing documentation? Are they spending a whole bunch of time in the in-basket? And can we make that better? So one of the other things that we want to also do is take that data, match it against whether they have done or not done learning experiences within our organization, and then start using those personalized messages to say, you might be interested in this, and see if we can impact some of those scores that way. Ultimately, moving us towards that proficient use of our EHR. This year, we've adopted natural language search. So the next step in our easy button process, or as I kind of say, easier button process. So we rolled out natural language search, which I thought was going to help impact returns to our end users, get them the right answer faster. Real quick, give me a quick thumbs up or a yep or a smiley face if you know what natural language search is. Seeing some thumbs up. Maybe. Molly, I'm trying to read your emoji there. So let's talk a little bit about natural language search. Natural language search allows our users to input questions in everyday conversational language, as opposed to using keyword search or specific search operators. So instead of just searching the word in basket, searching the question you're trying to answer about the in basket. So we trained our search model over the course of several months, and the vendor continues to refine the engine in the background. But what we're discovering right now is the hardest part of natural language search has been getting people to search by asking a question. And the reason this is important is because NLP is so much more accurate and helpful when a question is asked as opposed to that keyword. So when I searched for the in basket in our system, I got 250 returns because the word in basket shows up everywhere. You're going to send the letter from the in basket. You're going to review results in the in basket. You're going to send a message to a colleague in the in basket. There are just a number of workflows where the in basket is integrated into that workflow, and that word shows up everywhere. But when I ask a question on natural language search, how do I save time in the in basket? How do I create actions in the in basket? I've now provided the search engine more context about the specific answer that I want, and then it reduces the number of returns that folks are getting within the distribution system, within the centralized distribution system. We call it the learning library. So asking that question drastically reduces those searches. But the hardest part for us has been teaching people to search differently. So this week, I've had 5,226 total searches. 5,188 of them were keywords. So only a couple hundred were some sort of actual question. Robin says, seems counterintuitive to me that people don't search using questions. Relatedly, I wonder how quickly this behavior will change given interactions with large language models like ChatGPT. Absolutely. And that is kind of the next step of where we start to head a little bit. So natural language search for us is a foundational step towards something we call direct answer. Um, and that is what's next for us. So we're now working towards direct answer. Again, who's familiar with direct answer? Can somebody tell me what direct answer is? Direct answer search. You can type it or come off mute if you'd like. All right. I'm going to dive in and give it to you. So direct answer is kind of like when you use Google or Bing now that they have the large language model incorporated. You ask your question, then you're given a specific answer, step-by-step instructions. So this is an example of direct answer for me. How do I complete e-consent in the emergency department? We haven't implemented direct answer yet. We're testing it. So right now, my live end users and caregivers would get several options of tip sheets. Here, is this what you're looking for? And then it's on you to either read the description or click it open and discover, is that the tip sheet I want? Is this the tip sheet you are looking for? No, that is not the tip sheet I'm looking for. Hopefully it's reduced because it knows who they are and it knows what their role is in the EHR, but it can still give a few options. In this case, it came back and said, actually, here's what I think the direct answer is. Do these steps. Now I don't even have to open the document and I can just simply follow the instructions. If I don't think the instructions are quite right, we're producing the source here as well. So I can actually open the document that it's coming from. And then additionally, if you don't think it was right, you can tell us that. You can say, nope, this wasn't right. This wasn't quite right. And this is actually a little bit of why we haven't gone direct answer quite yet. We're still in the testing phase. We want to trust that most of the time, a majority of the time, direct answer is pointed to the right document. It's in the right context, and it's not mixing up a provider who might practice in multiple spaces. And bring in an answer from one of those other spaces. Joyce asks, do we have to add a lot of metadata to make this happen? No, so the vendor that we're working with has a I can't ever say the word, a GAI, can't ever say generative, in the background that is scanning the documents for all those source words to create its own meta tagging. And that's actually why we're doing a big testing phase of rolling out direct answer to ensure that it's cataloging that metadata appropriately. We do a little bit of helping just in general, because we keyword most of our documents so that our end users can at a glance see a keyword in the document and who it's intended for. But those two things actually also help the AI get trained on where the answers are coming from. And if this is an RN and they're in an inpatient setting, they can correlate that data, or the AI correlates that data and says, yeah, hey, that's helping me arrive at the right answer. So thankfully, we're not having to do a whole lot of that metadata training. Michael says, and Robin, the fact that we're moving towards natural language searches by asking Siri or Alexa by using devices and mobile phones. Yeah. I almost exclusively interact with ChatGPT via voice now. And I have full-on conversations. I sent a conversation that I was having with Microsoft Copilot to a coworker the other day, and she came back and she said, I like the way you talk to it as if it's a colleague. And it is. It is my digital colleague. And I happened to be invited to the first ever Microsoft Promptathon for Microsoft Copilot a few months ago. And the engineers who designed Copilot said that Copilot will learn from the tone that you interact with it in. So I don't know, when AI rises up under Skynet in a few years, I want it to remember that I talked to it fondly. Kind of playing there, but also just absolutely love to would prefer to make sure that the tone that it talks back to me in is friendly. So I have friendly conversations with mine. Okay, so that leads us into this the oh, I hit the on the benefits. Improved user experience, faster information, reduced cognitive overload, and this is a big one for me. By 3 o'clock in the afternoon, I start to lose my vocabulary, and I haven't been interacting with patients who are also asking me a ton of follow-up questions. So if I can reduce that cognitive overload, great. And then also that ability to see and open the source. So here is the next iteration of direct answer, the searching, natural language search, and embedding in the flow of work. We are now exploring putting an assistant right into the EHR. So it's going to be a hover button. Everybody jokes, oh, you're bringing Clippy back. Kind of, maybe, hopefully better than Clippy, though. Now you're going to have that assistant with you wherever you go. Wherever you're at in Epic, you don't have to go find a link. It's just going to be there. In addition to it having the natural language search embedded as a part of it, it's going to have communications that have been assigned to our caregivers. What is a potential challenge or barrier to having that nice little red dot show up if someone is assigned something? What do your phones look like? Or if your phone looks like mine, how many red badges do you have on your phone? And how overwhelmed do you might you get from notifications? So that notification fatigue is kind of a huge kicker for us. So we're also going to be defining a strategy of what actually is going to trigger that badge. So that we do reduce the notification fatigue, but actually increase some of the visibility. Right now, it takes an intentional step for our end users to go find the material that's been assigned to them. They have to press F1 in Epic to see that notification that I've given them. Now they'll get a nice badge that says, you've got a notification that requires acknowledgement. And we are not going to require acknowledgement on every communication we send out. We're only going to require acknowledgement on our 2 upgrades a year. And then if there's really big stuff like this week, I don't know if you've all heard about what's happening in South Carolina with the Baxter Corporation and IVs. So there is an IV shortage in the US because the Baxter production facility was wiped out in flooding. We've had to change a number of IV processes this week and put in new orders into our system. And we're publishing materials to support that. We've published new materials every single day this week to support the changing processes. And if we could be able to say, oh, hey, RNs in inpatient settings, you have a new workflow, or RNs in clinic settings, you have a new workflow, or providers, you now have a new order, and have them see that notification. Those are kind of the strategies that we're thinking about around that embedded assistant. Otherwise, having that assistant everywhere it goes within the system so that you can just click it and open it and ask a question. Like, hey, what's the most recent Baxter update? Hopefully we can get there. So it is context specific. It has all the embedded search features that we had before. It will have the ability to recognize screen context eventually as it matures so that it knows that I have opened it and I'm in a discharge navigator. So can we present some of the discharge content right up front? Or when I search for something, maybe it assumes that I'm searching for discharge content. Many of these items would not be doable without the vendor partnership that we have. And it's been fantastic for us because we get to spend less time trying to develop a chat client via SharePoint or a chat client via Teams automation. We don't quite have the production house that I'm seeing Chris from Health Partners on. Chris has a fantastic IT organization that does a lot of in-house production, and we haven't gotten that large yet that we're doing a bunch of in-house production. So we're relying on vendors and pushing them to think critically into the future about how they can make our caregivers' journeys easier. Yeah. Kiffin sounds similar to Walk Me. Absolutely. So I would actually say that our vendor is probably a bit of a competitor to Walk Me, except that they're focused in the healthcare sector versus the private sector. There are people within the Frederickson learning community who use this same vendor on the corporate side as well. But Walk Me or Scribe, there's a couple other ones out there as well, um, are all kind of very similar. Okay, so what does the data tell us about our journey? And here's what we do. So we have been on this journey to make learning easier for a few years. And is it helping? Are we impacting our caregivers' lives? We don't know that without measurement. And this is where I've been sharing kind of publicly, like, hey, this is what we're doing, and here's the impact it's having. So we've measured. We've measured with the leading research company. Their name is Class, and they have the Arch Collaborative, who is focused on bringing healthcare providers together and understanding the satisfaction around the EHR, satisfaction of training, of ongoing training, burnout. So they've started working in burnout and wellness data as well. What you see here is that we're still in the middle of the tornado, but year over year since 2017, we've improved our EHR satisfaction. And I can't contribute it all to my team, but we do know that people who engage in learning experiences are 12 to 21% more satisfied than people who don't. And that's where we get into this funky, ugly chart, but people who interact with the learning library. Our overall net EHR score in 2024 was 49.5. People who interact with the learning library, their EHR satisfaction score, 66.3. Even people who, so when we combine up the data across all of that, people who interact with the learning library as a combined whole have a higher EHR satisfaction. What we do kind of get into too is our efficiency sessions. This is a one-on-one in-person, virtual in-person session. What's interesting about that is if a provider has reached the point that they're requesting one-on-one and they don't find it useful, their satisfaction score burns out. It bottoms out at 16%. So if they're not finding it useful, they're really unhappy with us. It's kind of the only people who complain are the people who have had a bad experience tend to be. That's kind of what's happening there. If they've gotten to that point that they have met with another person and it wasn't helpful, man, we really impact their experience overall. So we're hoping to make that better. And that's where, if we can get it to them in the flow of work, where they need it, when they need it, and they know it's right and they know it's theirs, it should have a greater impact. So our data-driven next steps lead us to the future of our journey here. So the same survey will look at our initial training sufficiency and our ongoing sufficiency. So overall, most people have a pretty good, wow, I left a word out of that, have a good EHR training experience for the initial onboarding. We're at 57% agree. That is, that leaves another 43% that maybe they had a neutral or maybe didn't have a great experience onboarding. And part of that is because right now, Everything is instructor led. We have a number of technology issues where our instructor led has really turned into more of a lecture series than a hands-on series. And for the last 2 years, we've struggled to ensure that our incoming caregivers get into the practice environment and are able to join our virtual led courses, and we just haven't gotten there. So we're going to make some data-driven decisions around that, and you'll see that momentarily. But we do a pretty good job meeting onboarding needs. We definitely have room to grow in our ongoing training program. And that's because right now, my 11 learning specialists, nearly 100% of their time is dedicated to the first few days of onboarding all of our caregivers. Last year, we trained 10,000 people across the continuum of healthcare. And if I can use that time differently, then I might have some better experiences. So what we're going to focus on is going back to the basics, because we know that people retain 7 to 9% of what they learn in a class, right? So dial back the fire hose, give them some garden hose level amounts of information, and then make it available 24/7 in easily digestible modules that they can take at any point during their onboarding journey. We're going to set it up that they need to do it within 30 days, but anytime within that 30 days. And it's always there and available for them to go back and review. Unlike the instructor, who once you see our instructor, that may be the last time you see that instructor. Hopefully not. Hopefully you come back and do some one-on-one with us, but that might be the last time they see the instructor. So we've then looked at class, who has said, hey, e-learning is as strong of a learner experience as instructor-led experiences. When it's done well, it doesn't come with a sacrifice in impact. And we're really leaning heavily into that. So class published this impact report last year. We're leaning heavily into the fact that people are equating e-learning and instructor-led training as equal in impact. And in fact, our own data shows that people are getting more out of our asynchronous experiences than our instructor-led experiences. And a lot of that comes back to our asynchronous experiences, our multimedia experiences that include simulations, that include try it options, that include testing options where you can practice it without the guided part of the practice. And then it's also in micro learning. Now, I define micro learning as 20 minutes or less. So none of our courses are more than 20 minutes. And then you come back and can review it if you want, and it's set up on a personalized learning path. And so we're moving our focus from give you all of the stuff week one to give you what you need to onboard into our organization and then set it up as a journey over the entire year so that you get the information when you're ready for it. So again, back to that, make the learning engagement easier. We're going to offer weekly sessions that take and move us from that 100 level data knowledge to 200 level knowledge. And then by the time you've been with us for 90 days, you're probably ready for that 300 level knowledge. And we can start having data from Epic to look at and see how you're performing against others in the organization and where we can support you better, either in a one-on-one instructor-led journey or through some of our asynchronous modules. And so we're putting together some learning paths around that as well. We are also launching a more modern, I don't know if it's state of the art, but a more modern LMS, Cornerstone. We're moving to Cornerstone in 2025, and we will also be able to automate this journey for our learners. So that right now they have to just like keep coming back and asking us for it, or find our SharePoint site if they can find it, if they found it, if they're an employee of Fairview. Now we're going to be able to say, here's your journey. And the optional parts of it, click here, opt out if you don't want in. If you do, it's a part of your next journey. So, Robin, okay, so a couple of comments that I didn't get caught up on here. Thanks Joyce on the journey maps. Um, and Robin, any test out in that onboarding. So yeah, and one of the things here, I opened other presentations just in case I wanted to go off script a little bit. So I'm gonna do that. Give me just a quick moment here. Um, there it is. So we are setting up um, learning paths. And can you give me a heads up that you're seeing the new? Fabulous. Um, So we are setting up role-based learning paths. And as a part of those role-based learning paths, Robin, so like here, the Epic Basics stuff, um, these 5 modules across the top of that learning pathway, we get a number of people who have Epic experience because there isn't a major healthcare provider in Minnesota not on Epic. So they have Epic experience. If they want to skip all 5 of those, that's just fine. And then they can complete the shared courses. Ultimately, the test out is part of this learning path. Oh, my screenshot doesn't include it, but part of this learning path is the assessment. If they can pass the assessment, they're good to go. Whether they did or did not do all of the modules, we're tracking based off the assessment portion of that. But then it is there for them to go back and review if they want. And we're setting up a strategy where if they don't pass the assessment within 3 attempts, then we will do some one-on-one coaching with them. We want to support them in that journey because we actually want you to proficiently use Epic because it helps you be a better provider from a well-being standpoint, from a practice standpoint, and hopefully you're more loyal to the organization because we've supported you through that. So I think we see that in retention often. This has all been about that. Oh, I actually should say, I won't pull it back over, but one of the slides that I've used for leadership buy-in to this new asynchronous learning journey has been the fact that based on a study that Paychex did, which is an ERP, 52% of people feel undertrained during their onboarding. And 80% of people who feel undertrained consider leaving in their first month of employment versus 7% of people who feel adequately trained consider leaving in their first month. So this journey hopefully sets that stage that says, here's how we're making it easy. Here's how we're trying to support people in that onboarding journey. This has been all about the easy button for our learners. Let's talk a little bit about the easy button now for our learning development folks and our instructional designers. And this is where we'll get into the conversation here a little bit around AI. So who's been experimenting with AI? And based on the conversations from the chats from the opening question, it looks like there have been a few of you starting to experiment with AI, whether it be ChatGPT, Microsoft Copilot, or even just going out to Google and Bing and doing some of their generative searches. Again, that word, don't know why it's a tongue twister for me. So if you've been experimenting with some AI, what have you used? ChatGPT, Microsoft Copilot, and what have you used it for? So I think if you want to come off of mute and tell us some ways you've been experimenting with AI in learning development, or has everybody just used it as their research assistant? I'm seeing some nods there. So using the AI as research assistants often. Yep. Well, our team, we enrolled a team member in ATD's AI for instructional design intensive course. And they started to put together some really great frameworks from that course around AI. So we have our own tenant of Microsoft Copilot where we can point to our own documentation and it doesn't go out to the world. And it stays private to our organization. And within that, we've started experimenting, pointing Copilot at our facilitator guides and asking it to create a storyboard for our e-learning courses. We even experimented with pointing it at a facilitator guide and asking it to transform that guide out of Word into a PowerPoint presentation as an initial shell of an e-learning course. And of course, it's only as good as the prompt that it gets. So we're getting better at our prompt engineering. And I think that this AI course, I actually wish I had the screenshots from Amy at this point. I don't, but I would happily share some of the documentation over to you all after we get some of it downloaded. But there is the facilitator puts together a very nice framework that says, you've got your basic prompt, your informal prompt. If you use a structured prompt, you're going to get much better results. And that's what we haven't gotten to yet. We haven't taken that structured prompt and pointed it to our facilitator guides yet. And then we've been using it for some copywriting. So we needed to write a script for that whole e-learning journey that we're doing. We wrote a script for a video. And the first place we started was our Microsoft Copilot tenant. We fed it that PowerPoint and asked it to write a 2-minute video script to highlight the changes that we're making to our organization onboarding strategy. And it came back with it, and that was a starting place. And I would say it was 85% good, maybe even 95%, 90% good. And we just had to go in and kind of touch it up and edit it a little bit. Again, reduce some of that cognitive overload on my instructional designers or on me or one of my training managers to be able to focus on other things. And we just got to clean up the script a little bit. Jill says, prompt engineering is key, and then building out your prompt library. Absolutely. And the prompt library is also key. So once you find that prompt that works well, don't forget it. Start a document, start an Excel spreadsheet, get that library going around how it can help you. So in the ATD course around AI, the facilitator of that course pointed out a lot of things where you could prompt AI to go out and do the research. And, I want to build a course around onboarding new leaders into the organization and really built out the prompt to talk about, as you identify the objectives of that course, you need to further define the objectives of the objectives, create lessons, create engaging questions, create assessment opportunities. And he built this really long prompt. You have 22,000 characters, 2,500 characters, depending on the tenant that you're using to build that prompt out. And so many people start with act as an instructional designer and develop a course for leadership onboarding of new leaders. And that's their prompt. Anybody know the one prompt to rule them all? Or the best practice to end your prompts with? Who is using AI to teach you how to use it? Ask me any questions you have until you're 95% positive you have the information you need to meet the request. It's a great way to end your prompts. Tell it to continue to ask questions. And now I have been doing this vocally with ChatGPT. So I also add in and let's address those questions one at a time, please. Otherwise, it comes back with a list of 15 questions and I can't answer them all or remember them all. So we do it one at a time. So those are great ways. The other thing that I was struggling with, so before Amy went to this AI intensive course, I was writing what I thought was a good prompt, but turns out it's a pretty generic prompt. But I finally chatted with Microsoft Copilot, and I had asked it to tell me, as a learning development leader, how I could build out a prompt for Microsoft Copilot in Word to create an e-learning course outline. And it came back with a 3-paragraph prompt. And so I used it to teach me how to use it better. Yeah, Chris Gilson says, what other information would help you answer my question? That's a great one. Um, tell them the format you want it in. Absolutely. I am not here to sell ATD courses, by the way, but the ATD course got into the point of even telling you how you can, in the prompt, give it that you want to set it up as a header, or that if you have tables in the document it's pointing to, that you can define each of those tables and the information that that table holds for the outcome on the other side of the prompt. So some cool stuff there. Um, Chris says custom GPTs make prompting easier because they save the information you want to include, including all of your prompts, where you work and who you are. We have not gotten as far as building out the custom GPTs within our Microsoft Copilots. But I use custom GPTs and Chat GPT all the time. Just know that if you're using Chat GPT, don't give it proprietary information because it is not a protected tenant. Yeah. Let's see. So those are ways that we're looking to make e-learning development easier. Other things that we're also doing is within UPerform, which is what we're doing to build out. That's the organization that we're using to build out our e-learning. They have put AI in all of our description boxes, so we can click a box and it looks at the document that we just created and writes the description for us, and then we edit it. I can't tell you how many times I've gotten stuck on the first sentence of the description of a document and lost 15 minutes trying to come up with that first sentence. Written document descriptions for 23 years, and sometimes that first sentence is the hardest sentence to get started with. We've also adopted Amazon Polyvoice. So Amazon Polyvoice is not necessarily AI, but there may be, I've been hearing some rumblings that they might incorporate some AI there, but it is voice to text, text to voice. So we've adopted Amazon Polyvoice for our e-learnings. Really reduces the amount of time people are spending developing e-learning. And it's fairly humanistic sounding. It's not quite as good as ChatGPT's human voices, but it's there. And then the AI descriptions as well. What have I prompted around using AI to make learning development maybe a little bit easier? Are you embracing AI for learning development, or again, is it just kind of that research assistant? Yeah, Amazon Polyvoice, Robin, Amazon Polyvoice is like well said. We have a library of 25 voices we can choose from. Enter in your text and it does the voiceover for you. We have also been playing with, so if you have Microsoft 365 enterprise licensing, you likely have a product called Clipchamp. I'll drop it in chat here, actually. Clipchamp. We all joke about how hard it is to say the word Clipchamp. But Clipchamp is video editing software. I'm gonna call it a dumbed down version of Camtasia, but other people say it's a smarter version of Camtasia because there are some AI avatars within Clipchamp, and it does a really great job at that text to voice as well. Molly says, this is the second mention of Clipchamp in my world today. If you are low on budget, like I am, and your organization has Microsoft 365, this is a fantastic solution. And I will tell you, all of my instructional designers, all of my team members who are like, I want Camtasia. This has resolved that Camtasia desire. It's for being included in our enterprise licensing. It is a very nice piece of software. All right. Well, I am going to do this. I'm going to say thank you all for spending some time with me today. Thanks for chatting through some of our strategies and our journey at M Health Fairview. If you scan the QR code there, you'll get my contact information. But of course, feel free to reach out to me via my email or on LinkedIn. I am always happy to chat about our journeys. I'm always happy to chat about what we're learning. And I'm always willing to learn from others. So one of my favorite parts of community is learning about what other people are doing. Because like I said, I don't have it all figured out. We've leaned into some strategies that seem to be working for us, and we're backing it up with proven data. But that doesn't mean that we've got it all figured out. So has anyone used Hey Jen? So if you're missing the chat, Jill is asking about Hey Jen. I have not heard this one. Jill, do you want to unmute yourself and talk a little bit about it or add a little more context
Or
into chat?
so, and I have not used it myself, but I've seen demos and heard about it. It allows you to create and then translate videos using AI, and it's kind of amazing. It's impressive to see you can, make a video of yourself speaking English and then translate it into another language, and it will look like you are speaking the language
Oh, that's
and
fantastic.
sound. Yeah,
Wow.
yeah. hmm So I'm curious about what this kind of tool may mean to translation of e-learning and things that have audio in the future.
Yeah, absolutely.
hmm
Um, I am forgetting it now. Maybe it's Canva. Did I see that Canva? Oh, I might be making this up. Just released translation to Spanish on some of their videos and some of their within some of their AI generated content. So some accessibility opportunities coming in the future. I know our interpreter services director would immediately probably throw me and shun me into the basement for suggesting any sort of AI translation at this point, because you just got to be careful how it translates. And, AI
Mhm.
is known to hallucinate, and I'm sure that it hallucinates into
Yes.
other languages also.
Yes, you need reviewers on your team who can review that translation for sure.
Excellent. Yes. Very important. Double check their work. And I mean, if you're using AI in English, even double check its work. Have your sources for backing up the AI's research. What other conversation or questions?
Checking the chat here, but
Hey,
you can feel free to unmute yourself. Yeah, go ahead.
um, sorry, I asked Michael to do this, but I'm going to just jump in and do it. Carolyn asked a question in the chat that I think we were all chatting at the same time and was overlooked, but she was wondering about the reference source when you offered about equally effective e-learning versus in-person training.
Oh, sure. Yep. So the reference source is based on the class Arch Collaborative participants. Um, so the unfortunate thing is, in order to get that source, you have to be an Arch Collaborative member. But if you are in healthcare and you are an Arch Collaborative member, oops, sorry, this is now Zoom, not Teams. Got to find my share button again. There we go. So it is this impact report. I am sharing the slide, correct? And not, okay.
Yeah, you are.
Thank you very much for confirming. So it is this impact report, self-directed e-learning 2023, and they released this in November 2023, so about a year old. Carolyn, if you send me an email, I would be happy to slide you a copy under the table. I can do that. I get to share it. I just can't share it like to a large forum, but I can independently share it. And I actually believe that Alina is one of the contributors to that impact report. And even our own strategy to moving to asynchronous. We studied UC Health in Colorado, Baylor Scott and White in Texas, Aspirus Health in Wisconsin, and Gunderson Health in southern Minnesota. All who I'm used to being the leader in technology often when it comes to learning. I'm behind the ball compared to some of these other organizations around an asynchronous learning strategy. For this. These other folks have been doing this. Baylor Scott and White's been doing this since 2018. Infirmary Health in, I think it's Alabama, has been doing it since 2016. There are other organizations out there leading the way in this. I kind of had to, I'm going to use the word fight. There was no physical fighting, but I had to kind of fight with Epic this year. We implemented a new module. And I said, our learning strategy is asynchronous, supported with a practice lab afterwards. And they pushed back very hard and said all of the best practices show that it should be instructor led. And we disagreed and we rolled out with asynchronous e-learning. And that 4.75, that includes all of these nurses who are scattered throughout North Dakota, South Dakota, and Minnesota, providing home health and hospice care, learning their brand new system via e-learning. And they are a big part of why that satisfaction score is a 4.75.
Other questions you have for Derek while we are here, and bend his ear while we've got him, or other examples you'd like to share?
Yeah, Derek, if I should ask you a question, Chris Gilson from Health Partners. We talked the other day about the e-learning approach. Have you seen a difference in scoring between different types of participants? So, for example, do surgeons rate e-learnings higher than front desk staff?
Sure. So I don't quite have that data yet. So we are on a cascade journey here. So the data that we have up is from residents earlier this year. So we did all of our resident onboarding asynchronously. It is from our entire OpTime onboarding strategy. So nurses, techs, and providers and anesthesia providers. And then it is from our Fairview home infusion implementation. Our ambulatory care and inpatient care providers go live November 4th. And then the rest of a majority of our clinical roles go live in January. So I'm not at a point that I can do cross comparison of data quite yet there. I will share that we had, and this is one instance, so take it with a grain of salt, but we had a clinical educator joining our organization in the OpTime space. We asked her to pilot the e-learnings for us, and she came back and was like, this is blown away by what you've done and the way that you used your multimedia approach. I've learned what I anticipated to learn via onboarding, and she had nothing but super positive things to say about it. With Fairview Home Infusion, definitely we're starting to see that line of new nurses and experienced nurses. And I'm only calling this particular comment out because she said so, but she said, I'm old and I don't learn this way. I want an instructor. And I think we're going to still see that. I think we're going to see a little bit of a generation gap. And I still think that we're going to see an interesting gap. Chris, was I talking to you about you'd brought up the fact that younger folks, don't have computer skills as much as they have mobile device skills. And so I think there's going to be another interesting technology divide starting to happen. The folks who were raised on a phone or a tablet versus a mouse and a keyboard. So prepare for that gap in knowledge. And I think, Chris, you're experiencing some of that in some of your roles. I'm anticipating experiencing it in some of my roles, especially some of the entry-level roles where folks don't have to have healthcare experience. They don't have to be Epic experienced, but we've adopted a digital to the core strategy within M Health Fairview. So at this point, it comes down to hiring strategy. You're working in a digital healthcare organization. Some basic concept, some basic computer skills need to be a part of that hiring decision. And I think we're just unfortunately in a moment of time where staffing says, I need the person more than I need the skill set. And then we're seeing that in our technology training spaces that we're then having to teach some of those basic computer skills. I don't have that gap addressed yet with this e-learning stuff. Once we get through the initial transition to e-learning, do we go back and create something that helps people understand some of those basic computer skills? Possibly.
That's really an interesting thought. I hadn't thought about that before, Derek. I just want to engage with this for a moment. As when you initially started your comment, I was thinking, well, that's a benefit of voice to text, right? And how many people are already talking to their machines and expecting to get answers back based on that, but having to then interact with something without your voice, or to make it accessible to those who don't have voice. That was a different twist to that. So I'm glad you extended your comments about that.
Yeah, I don't mean to pick on the generation divide all the time on the older side, because I'm starting to be in that. I'm in that older side. There are days that I used to be the technology guy, and now I go, oh man, when did I fall into this other aspect of not knowing how to solve all the problems? Yeah, no, I think there's some real interesting technology divides and gaps and challenges that we're gonna see into the future here. I was worried that I cut too much content from my presentation today to take us 90 minutes. And here we are at 12:55. I want to stop and thank Frederickson for this opportunity. I love these communities, and I love the fact that this is a part of what you do, and there isn't the high pressure sales on the other side of these phone calls. I just really appreciate the opportunity to learn from one another and have these kinds of learning conversations. Thanks so much for having me in today.
Yeah, thank you, Derek. Thank you so much. And we know we really do learn best from each other, because you can't replace the human interaction. And that's what we really value, is those relationships that we're all building with each other to teach each other. And because we all know different things. And the more we can share, the more we learn, the more we grow together. Thank you, Derek Harley, for your research data, for your tips, for your best practices and lessons still learning. We appreciate your transparency and the fact that we're all learning. And that's why we just love learning and we embrace it, because we're all growing anyway. So when you go with it, we just have more fun. So thank you so much for sharing today. And thank you all for joining us. Remember, we would love to have you continue to stay connected with us in all the different forums we have, and the happy hours and all sorts of formal and informal. We just love to meet you and meet you where you're at. So just make sure you stay connected with us. And if you have questions or suggestions, or you want more information, just drop us a line at info@fredericksonlearning.com, and we will continue that connection and make that happen. So thank you, everyone, for joining us today. We hope you have a wonderful afternoon, and wherever you are, get out and enjoy some of that fresh air and sunshine. So thank you so much for joining us today.